Entrifeed is a company dedicated to aiding those who cannot receive nutrients orally. For patients who suffer from various swallowing complications or neurological ailments, feeding tubes are used as an alternative method of feeding. In order to deliver nutrients, enteral feeding tubes are inserted into the abdomen and through the stomach wall. Currently, there are around more than 500,000 patients with feeding tubes in the United States alone. One major variety of feeding tube, the balloon anchor tube, is secured via an expandable sac. This tube can be installed in the interventional radiology department using a minimally invasive procedure that involves a small incision in the abdomen to insert the tube, and inflating with water to secure. However, the balloon is susceptible to leakage and deflation, thereby increasing the risk of dislodgement. Tube dislodgement is the most common reason for feeding tube patient readmission. In the interventional radiology department alone, around 17,000 patients are readmitted each year for tube replacements, of which 13,000 are due to tube dislodgement. These replacement procedures can incur an additional $7,000 or more for a patient. The main cause for dislodgement is by physical disruption, either through patient pulling, patient transfer, or falling. The tube can also be dislodged by bodily changes such as increased abdominal pressure, or by mechanical defects such as deflated balloons, weak tube security, and ruptured tubes. The current tubes on the market are inadequate in preventing dislodgement. These reasons bring us to our needs statement. Physicians need to minimize the dislodgement of enteral feeding tubes in order to avoid patient readmission for feeding tube replacement procedures. Entrifeed is focusing on improving the design of feeding tubes and their security and reliability so that patient readmissions can be reduced, thus decreasing the amount of time and expenses needed in order to maintain a feeding tube, a device vital to patient health and recovery.